Professor Jian Li, green tea is more than a drink. He credits it with helping him to think.
When I'm doing research, we sometimes need great ideas. We need to be relaxed in some way. And tea probably is one of the catalysts, in my life, I believe.
The thought he puts into preparing tea reflects his broader approach to research, considered and meaningful with a desire for impact. Professor Li is an antimicrobial pharmacologist on a mission to combat superbugs, strains of bacteria that have become resistant to almost all current classes of antibiotics.
This means in the clinic it's very difficult to identify an effective antibiotic to use in patients.
Superbugs are on the rise as bacterial cells develop ways to outsmart antibiotics.
For example, they can degrade antibiotics, they can modify the antibiotic target to minimize the bonding of antibiotic molecules with the target, and they can also pump out the antibiotic outside the bacterial cells.
The World Health Organization has identified antibiotic resistance as one of the 3 greatest challenges to global health. But it's a challenge that many of the world's major pharmaceutical companies aren't tackling.
Big pharmas have left antibiotic market because they're minimal profit.
So Professor Li's team at Monash University's Biomedicine Discovery Institute is taking up the fight in 2 major ways. The first is to improve the way we use antibiotics already available on the market.
We try every effort to optimize antibiotic use in patients.
That means using just the right dosage regimens in individual patients to treat the infection while minimising drug resistance and toxicity. His research led to the first scientifically based dosing guidelines for last-line antibiotics known as polymyxins.
And that's very exciting because that have been widely adopted by hospitals around the globe and have changed clinical practice greatly. So that's very rewarding.
Professor Li is also developing novel peptide antibiotics to treat deadly infections caused by bacterial superbugs, something made possible by 2 decades of fundamental research undertaken by his lab.
We took the drug from concept in the laboratory through the drug discovery pipeline and then get into clinical trials. We can see the true value of our knowledge and also program can create for global health.
He says he's deeply honoured to become a Fellow of the Australian Academy of Science and wants to use the platform to advocate for rapid clinical translation of breakthrough biomedical discoveries in order to target major global challenges.